improve the health outcomes and also impacting educational outcomes as well. And that's because it's located in the school.
DC children and teens deserve a world-class system of school-based health centers. We have the resources in this town. We are blessed with a rich array of health and mental health and education and youth development resources. And think of the power of uniting all of those together through a collective vision, a roadmap, if you will, where we can wrap all of those terrific resources around our children and adolescents by delivering care in a very integrated way in their school system. We think about sustainability. Another way of thinking about it is, how do programs endure? What are the characteristics of programs that have successfully lasted a decade or more? And what we find in those programs is that they share three things in common. They have developed strong partnerships. They have operated under a very sound business model, and they deliver a service that is the highest of quality. All three of those legs of the stool, if you will, are critical.
The primary benefit that I have personally noted is that the students have a wonderful relationship with the physicians on site in the building, and they're very comfortable with their use of healthcare. And I also noticed that the students are willing to share information in the school-based health center setting that they don't necessarily share in the primary medical doctor's setting.
We have all of the family planning methods on site in our school-based health centers, so we can insert an implant or insert an IUD in a patient on site in the school-based health center. So I think we've made tremendous strides in reducing the barriers that teenagers face to getting family planning services in the city. I think in terms of where we want to go, first of all, it's increasing our general enrollment in school-based health centers so that we can inform more students about our services and give them access. And then secondly, it's really to follow the latest evidence-based guidelines on directed counseling for the long-acting reversible contraceptive methods for teens, where the evidence really shows that it is, they first of all are very safe and effective in teens, and secondly, that if providers and people in the healthcare setting engage in directed counseling for teens for these methods, they're much more likely to use those methods. And I think that's shown in our outcomes in our school-based health centers, where we have almost triple the rate of LARC usage among our student health center users versus nationally among teenagers.
There's a disparity in the availability of services to young people who attend schools where there is an operational school-based health center and those who do not. As someone who sees teenagers in the emergency department and has had the occasion to, even though we are a pediatric facility to deliver babies of adolescent moms in our emergency department, I realize that this is a resource that is needed across the city and needed on a more widespread basis.
This model has demonstrated its effects over and over and over again. We know what the solution looks like. We know what the answer is in providing access to comprehensive care for children and adolescents in our community. We've got fine examples of it going on in pockets around the city, but we can do better. Let's take this idea and just rip the box open and grow it big. Let's take this to scale. We can do it. We can do it. We have the resources, we have the political clout, we've got some of the finest healthcare and education institutions in the country here. Why not?